we're going to talk about the risk factors now for liver cancer, particularly in the African American community. As we know, a risk factor is a reason why someone is more likely to get a disease than the average person. Okay. Common risk factors for liver cancer are divided into underlying medical conditions, some lifestyle choices, and also ethnicity. There's a big interplay among this risk factors. So ethnicity may predispose some patients to certain medical conditions. Lifestyle choices may predispose you to also some medical conditions. And we know that all of this work together and they can cause liver cancer. But before getting to liver cancer, the big stop along the pathway for developing of cancer after exposure to this risk factors is actually liver cirrhosis, and we will talk a little bit more about liver cirrhosis as we move down. But just to give you an idea of what we would consider common risk factors for liver cancer, I think the two big ones are hepatitis, which are viral infections, hepatitis B and hepatitis C. Patients that have type 2 diabetes and obese patients are also more predisposed to liver cancer. Lifestyle choices, including diet sharing, smoking, alcohol, can also contribute to liver cancer. Hepatitis is a risk factor of liver cancer. Hepatitis B virus infections are more like patients who have hepatitis B virus, particularly African Americans, are more likely to die from their hepatitis B than non-white patients. I had mentioned before that chronic exposure to hepatitis causes cirrhosis. I think this is a good time really to pause and talk a little bit more about cirrhosis. Imagine if you get a cut on your skin. There may be some bleeding. After a while, that stops, and then there's some swelling, maybe a little bit of a pain, but eventually it will heal. And many times it will heal with a scar. A lot of the things that are risk factors for liver cancer, they cause injury to the liver. In an effort for the liver to heal itself, there is swelling, there is inflammation, and eventually there is, in a way, scarring. So it is this scarring of the liver that we call liver cirrhosis. As you can imagine, when there is a scar on the skin is not as supple, may not be as pliant as the rest of the non-scarred skin. In the same way, when the liver is scarred, the liver is not as supple, is not as pliant, it doesn't do its job as well as the non-scarred, non-injured liver. So hepatitis B, hepatitis C, which we'll talk about later, and all the other risk factors mainly cause liver cirrhosis. And it is with this liver cirrhosis that there's an increased risk of liver cancer. It is important to note that in contrast to some of the other risk factors that we will be talking about later, there are patients who have livers that have hepatitis B infection who do not develop liver cirrhosis, who end up still getting HCC. So I mentioned that risk factors affect the liver, cause the injury, and then there's a destination of cirrhosis before cancer. This doesn't always happen in hepatitis B. For hepatitis B, patients may have the infection and then go straight to cirrhosis before even getting to, and go straight to liver cancer before even getting to cirrhosis. Therefore, it is important to ask your doctor to screen you for blood for hepatitis B if you have never been vaccinated or tested. Now, we have a few guidelines around who should be screened or not, but this is a conversation that I think that you should have with your primary doctor, particularly if you've never been vaccinated and if you've not been screened in the past, and if you were maybe involved in some high risk job. Because if you can be vaccinated against hepatitis B, then potentially we can reduce the risk of hepatitis B causing cirrhosis or hepatitis B causing cancer. hepatitis C infection is a leading risk factor for liver cancer in the United States. Similar to hepatitis B, African Americans are almost 2 times as likely to die from hepatitis C compared to their white counterparts. Um, um, the good news, the very good news here is that most patients that have hepatitis C, before they develop liver cancer, they have liver cirrhosis. Even better, hepatitis C can actually be treated and it can be cured. So, if Black patients, everybody actually gets screened for hepatitis C and we treat their hepatitis C, our hope is that this will reduce the risk of liver cirrhosis and therefore eventually liver cancer. Black Americans are almost twice as likely. So twice there is about 100%, rather than 120%. So I feel a lot of people picked D rather than C. But that's a fact. It's almost twice as likely, almost 100% die from hepatitis C compared to Hispanic white individuals. Um, Part of the reason is because they have more complications. Part of the reason is that they are also more likely to have other risk factors in addition to the hepatitis C. And the risk factor here that is unfortunately prevalent in our community is diabetes, type 2 diabetes mellitus. Um, as we know, Black Americans are again almost twice as likely to get type 2 DM, type 2 diabetes, compared to white Americans. This is driven by a higher rate of obesity in the Black community. We also have a higher rate of complications from diabetes because of poorer glycemic glucose control. This is related to racial disparities to access to healthcare in the United States. So it is important to actively manage type 2 diabetes. So type 2 diabetes on its own is a risk factor for liver cirrhosis and liver cancer. But in addition to hepatitis C virus, it's a dangerous mix when it comes to risk factors for liver cirrhosis and liver cancer. Obesity actually has a medical definition. Okay, for men, we can define obesity for men and women actually based either on the body fat percentage, which is a little bit more difficult to measure, and the body mass index, which is a little bit easier to measure. We think that if a woman's body fat percentage is greater than 33% of her the rest of her body, then that is obesity. For men, it's about 25%. I think the BMI is an easier way metric for obesity. It is based on the patient's weight for their height. And a BMI of 30 greater than 30 is considered obese. A BMI of greater than 40 is considered morbidly obese. I think that if you do not know your BMI, then there are calculators online that you can just plug in your weight and your height, and it will give you what your BMI is. You can talk to your doctor to discuss. Obesity is a risk factor that we can modify that can reduce the risk of liver cancer and a few other cardiovascular morbidities. Next slide. We need to talk about diet, because diet is also a risk factor for liver cancer. A diet that is very rich in red meat and fatty foods increases the risk for being overweight and obese, and also increases the risk of development of type 2 DM, which are risk factors that we talked about. So, in general, we think that you should talk to your doctor about dietary or lifestyle changes that you can make. We think that it is good practice with good quality evidence base to add a lot of fruits and vegetables with our diet. Even if you don't lose weight after you have changed your diet, because this is a problem that people may have. Even if you don't lose weight, if you change your diet, please note that you still get health benefits. So patients who do not lose weight, they still are able to reduce the fat in their liver. So this is another reason why, considering changing your diet is an important way to combat the risk of diabetes, combat the risk of liver cancer in this case. So next slide. We're going to round out our discussion of risk factors by looking at a few other lifestyle choices that we can make that can help us reduce the risk of cardiovascular morbidity in general and reduce risk of liver cancer in particular. So patients who are heavy drinkers, alcohol is a toxin. Patients who are heavy drinkers are more likely, 5 times more likely to get liver cancer than those who are heavy drinkers. The CDC recommends small amounts of alcohol, no more than 1 drink a day for women, no more than 2 a day for men. The best amount of alcohol is really no alcohol. I think that we should be, not I think we have good quality data that says that we should be treating alcohol the way we treat cigarette smoking. The best amount of cigarettes is no cigarettes. That should be the story too for alcohol. But as long as you're not having more than 1 drink a day for a woman, no more than 2 a day for men, we think that this is a good sort of level of moderation. I've talked about smoking. I don't think we can. I think everybody knows now that we should stop smoking. Never share needles. Never share needles. Even if it's for getting tattoos or for piercing. Sharing needles is one of the ways that hepatitis C virus can be transmitted, and therefore, if we want to reduce the risk of some of these blood-borne causes of liver cancer, then sharing needles has to be a no-no.